Welcome to the Spark Standards in Action Showcase, where active Spark community implementers share their perspectives, experiences, and example implementations of some of the FIRE implementation guides designed by the Spark community. Here we will have community representatives showing the art of what's possible using the community design specifications to enable safer, more connected, and more efficient healthcare. I'm your host, Michael Hosking, Deputy Lead for Community and Engagement for Sparked. For this showcase, we'll jump straight into the discussion. For a background on Sparked, what it is, our goals, and related resources, please visit sparked.csiro.au. Today, we're joined by Akanshka, Mike, and Andy from Magentus, and we've got Ross from Healius Pathology and Angus from Sonic Healthcare. Bit of a brief intro to each of them. Angus from Sonic, he was born into pathology, literally. Angus worked in every lab role from courier to blood collector before diving into lab information system development and digital health. Now back at Sonic, he leads FIRE integration and is a co-chair for the Sparked e-requesting TDG, providing you can't really escape the family business from the Sonic perspective. Andy is from Magentus. We've got Andy, who's an architect working in clinical informatics and systems architecture and organizational interoperability. He's previously worked in a variety of design and developmental roles across a variety of distributed system areas in government, education, and corporate entities, and also holds a PhD in computer science. Akanshka has over 17 years of experience in health technology and currently leads Magentus's interoperability team, focusing on e-requesting for pathology and radiology. She's passionate about streamlining digital solutions to improve healthcare outcomes. And Mike's been at Magentus for 7 years and focuses on strategic partnerships connecting different parts of the health ecosystem to the Magentus Health platform. And Ross has over 15 years of experience in pathology IT and leads the strategic delivery of digital platforms at Healius. He's driven major lab system integrations and was instrumental in positioning Healius as an early adopter of FIRE-based e-requesting. So thanks for all of you for joining us and sharing your experiences, and also the demo, which we're excited to see. So starting with you, Andy, what are your current challenges of health information sharing in Australia?
Oh, that's a very long list. I guess one thing to start with is that new is always fun and interesting, but the stuff we've lived with for 20 and 30 years really doesn't go away in a hurry. So new investments in health information sharing have to coexist alongside old investments in health information sharing. But that gives an opportunity to, I guess, relook at how information architecture and system architectures support that transition and change to new innovative ways of better use of information. So bespoke kind of previous integration attempts really have to be transitioned to ones which are reusable, and it's simply the pragmatics of a business investment. It's too expensive to continue to build new bespoke investments or bespoke integrations. Those investments are not just once off, they continue to be paid for a generation. So if you can move it to something which is repurposable and reusable in a standard way, then it's a better investment for all parties involved. So that's a big part of it. Also to this, that none of this happens for free. There's a cost associated with health information sharing, both the building of the technology and the supporting of it. And therefore, any of that work has to have a solid financial underpinning. It's got to have a clear business model that takes it forward, and also has to provide clinical value and clinical innovation to, what will inevitably be potentially a change in how users interact with that data. And that kind of brings it to semantics, semantic models and terminology. We have learned better ways of representing stronger semantics in clinical informatics. We know that there have been a lot of strides taken in the last decade in terms of the use of terminologies SNOMED, but that's not the only terminology. There's a lot of terminologies out there. Having a good foundation terminology leads to better semantics and better information sharing. We cannot rely upon people to always act as a gateway for that information sharing. We must be able to represent it in some form of computable or semi-computable form so that we can gain efficiencies in that investment. I guess that finally leads to what's the answer to all this? Well, in my opinion, the answer to this is APIs, application programming interfaces. It is a contract that enables interoperability to flourish between organizations that need to work together. And they're not just about data. Unfortunately, they also inherently are about the workflow that brings that data together into something that delivers value, better clinical care, and a sound financial underpinning for investment.
Well put. And what about you, Angus, in terms of your perspectives? Are there any things that you'd add in terms of the challenges of health information sharing in Australia from a Sonic view?
Yeah, I guess I look at it and I think we need to start chipping away, getting away from the standards we use today. They're incredibly old, from the 1980s. They were really built for moving health data within a hospital network, a closed network, but today we try and move it all over the internet using the same standards. They were custom built on custom protocols and custom data structures for healthcare. So new university students that we might hire, resourcing, they don't get taught this stuff at uni. So they're quite archaic. They're built, the protocols they use are very low level and quite odd. So many of the modern contemporary security stuff struggles with it. And just lack of conformity. I mean, HL7 version 2, people, wear with a badge of honor the saying that if you've seen one HL7 interface, then you've seen one HL7 interface, because they're all different. So, challenges with resourcing because of that old technology, proliferation of bespoke interfaces. We end up with multiple and they all have to be maintained. Slow turnaround times for new connections because of those difficulties. Lack of diverse, compatible health data tooling software, because the very niche crowd of software vendors who get involved with those old standards because of the baggage they bring. And costly security challenges due to the old legacy protocols. So yeah, really just focusing on what we have now is very old, looking very creaky and old, and it's time for a refresh somewhat.
Right. And then now, in terms of, I guess, the problem that Spark solves, how would you describe that in terms of what the opportunities are with Spark from Magentus's perspective, Mike?
Look, I think Spark has sort of galvanized the community around getting the fire standards to a foundational point within the community. So it's been good to have the Spark organisation sort of bring some acceleration to a set of standards that Australia can use and adopt for health information sharing and workflows. I think that that role has been necessary to sort of take the standards, the HL7 fire standards from international standards, and develop an Australian-based version of that, and bring it through the standards process so that the community in a civil society have been able to agree on the standards in a very bottom-up process with lots of diverse perspectives, and come to an agreement that we can all rally around and then build towards. So in particular for us, having done some work with both Sonic, Healius and ACL on the e-requesting standard, national standard, we want to see that be a standard that gets used in the broader industry, so that there are multiple players in industry that can use that standard in an open API way. And it's really important that that was shared in such a way that it's open, to Andy's previous point, and continues to be open so that multiple vendors, like ourselves and others, can use that as a standard for sharing. In this particular instance, it's a request, but in the same way as we've used that, if we talk about that particular standard, the same way that the broader health information data set would be exchanged across our sort of federated healthcare system.
Yeah, I definitely appreciate the civil approach in terms of how we work as a community. I think that's something that we pride ourselves on. Ross, what would you say your perspective on terms of what problems Spark solve?
I think for us, it was a case of where do we get started? So we're in the midst of quite a detailed digital transformation. I think fire was a discussion, something we knew was coming, and changes were being made to PMS systems to integrate for it. With Spark, we were able to jump in, we're able to connect with multiple members of the community, of the healthcare community. Angus and I met at Spark, for example. And I think without that kind of opportunity, we wouldn't be able to have those discussions. We wouldn't even be able to table discussions about what we do in different areas between pathology players and things like that. So the ability to connect with other people in the industry and the ability to accelerate the work we were doing by examples, workshops, the things that Spark put on for us were amazing, to be honest.
No, that's great. And Angus, are there any examples where you feel that Spark has helped accelerate your progress as your work with Sonic?
Very much what Ross said. Like we've just had a lack of engagement in standards development for over a decade. It wasn't just a bump in the road; it's been like a decimation. We've just had, for 10 years, we've had no coordinated cross-industry, standards development work. It's all been sort of in-housed, and so getting us talking, getting us thinking of new ideas is the main thing. As Graham's quoted saying, interoperability is primarily about people. It's not really a technical problem, and that's what it's doing for us. It's letting the people connect together and agree on what they're doing. So yeah, it's really that aspect, I think, is the main thing that Spark's brought.
Yeah, absolutely. And Akanshka, in terms of Magentus's involvement, why is Magentus involved in Spark?
I think as a practice management system, we do have a very strong desire to have some standards in place rather than that we can rely on, rather than some bespoke solutions which are very difficult to maintain. They become fragile over time. They are very hard to scale up. So having those standards in place is something that we really do appreciate. We really do want to encourage that. Also, from our specialist perspectives, we know that a lot of our specialists, they want to know whether they have to follow up with the patient, whether the patient has gone for a test or not. So, and this all happens outside of the system through phone calls, through calling up. So having a place where they don't have to go around to find those statuses, they can simply see in their system, is something that we know our specialists really appreciate. So from all those perspectives, it's something that we really do encourage, really do want to spend time on.
Great. And Ross, what about Healius? Why is Healius involved?
I think it's important to have an overview of what's happening with the standards as they evolved. I mean, when I started, it was kind of like HL7 was set in stone, but at least with Spark and with community discussion, we get to have a say in sort of how some of these technologies are formed and what's useful for Australia specifically, with some of the AU core fundamentals and things like that. But overall, yeah, it's that community sense, that connection that we seem to be getting as an industry, which is amazing.
That's great. And Angus, why is Sonic involved?
Well, I'll be a good Sonic person, and two of our corporate values are be enthusiastic about continuous improvement and commit to service excellence. So excellence isn't maintained through complacency. So new standards present new opportunities, cleaner workflows, greater feedback for customers, improved patient safety, and clearer analytic data. So the safety, the quality, the speed and consistency of modern laboratories are built on automation, and that automation is built on software, and that software is built on standards. So standards such as that being developed as standards drive all these aspects forward, not just for Sonic, but for the entire industry. It lifts us all up. So Sonic was a founding member of Spark, and through its standards, we've collaborated with Magentus and our competitors, Healius, Ross is here now, and we've got improvements for all of us. We're getting improvements for pathology and radiology. We're applying it there. So we're doing e-requesting. We're getting real-time status updates back to the doctor, which we didn't do before. We're using national standards catalogues based in SNOMED, which improves data analytics collection. And very soon, we're going to be doing improvements through patient choice, allowing requests to move between providers, between competitors, which creates more safer interactions for patients who wish to express that choice. We're not making transcription errors as they move between our labs. So there's huge benefits for us. And it's about keeping on that cutting edge, because these things open up new opportunities. If we keep using what we've kind of squeezed the last we can out of the old stuff. We struggle to make it go further, but here we get new opportunities presented to us.
I think that's really well said. And I think that consensus and community building of whether you're a competitor or not, I think it's great to see everybody working together. And you mentioned, I guess, the standards that you're implementing. I guess, Andy, from your perspective, what standards are you implementing that are related to Sparked?
Well, the main focus that we have is around e-requesting, of course. That's building block. I think collectively, it's been a few years now that we've put a lot of investment into looking at the FHIR standard at its very foundation of R4 and building from that a way of meeting the business need. And as Angus pointed out, of really around taking it beyond the old versions of collaboration we've previously had with HL7 version 2 standards. We had a lot of investment in that. Sparked is our opportunity to take a lot of this investment and learnings that we've had in implementing FHIR-based requesting over the years and share that and get feedback from the community and build greater consensus around taking it forward. These things are only going to get bigger and more useful, not just in diagnostic requesting, but then in general into referral spaces, and also having reporting associated with those requests. And that really is quite foundational. It all relies upon some of those building blocks that AU Core provide as well. And that then in turn needs the AU base, which is another layer of agreement that the country has created around that Australianization of the FHIR standards. And you know, we all know that there are a lot of standards out there, and while the FHIR standards are in use in this particular area, we also heavily rely upon obviously SNOMED and other terminologies, LOINC. They're all part of the collective mix, and we have dependencies on standardized information artifacts that other parts of government hold as well. So there is really a whole momentum shift in formalizing a lot of these building blocks so that they can be used within that FHIR community. This is not saying that H7 version 2 is going away anytime soon. It is going to coexist and be part of that ecosystem as well. But we're also, I think, collectively not going to let it hold us back in terms of innovation and, you know, additional value that we can provide. In the end of the day, it really is about delivering better patient care, and to do that, it's really focusing in on the patient have a very active role in that care pathway, and also concentrating on the collaboration across the healthcare sector. So it's about workflow and about working more efficiently and better together with this supporting information flowing to support that outcome.
Mm-hmm. That's great. And Angus, in terms of the standards you're implementing, in terms of the demo, I'm assuming it's also requesting. Is there anything else that you're referencing as part of this work?
Yeah, well, I say we're not implementing, we've implemented. We've been live for over a year now. Ross has been alive for much the same time. So we're not just designing it, we're actually living it. So we've been lockstep with Sparked standards development from the very beginning. And in fact, we've often been one step ahead, which has been good. However, we're completely committed to the compliance with the Sparked FHIR IGs and requesting. I think as industry leaders, that's Ross's organisation, our organisation. We set an example for the others. So I often think, you know, standards they're never 100% perfect, but you get roughly 80% out of this sort of Sparked process, and you don't get it anywhere else, right? So you have to have this something like a Spark process to get you to that 80%. And somewhat the next 20% comes out of the big market leaders complying to that and weeding out any vagaries at the end. So I think we hold a very special position to sort of lead and focus that we are going to engage with the national standard and drive everyone else to it. Because there is a trap that big players can go off on another tangent, and because they run so much of the market, others follow in that direction. So I think it's very important that Spark has, Healius, Sonic, ACL involved, and because that brings everyone along on the same journey, which creates interoperability in the end.
Absolutely. So I guess now we're wanting to see it in action. I'm really keen and excited to see the demo that you've pulled together. I'll hand it over to you to pull this whole thing together to show us how it all works.
For having us. My name's Mike Strachan. I'm joined with Akansha and Andy. We're from Magentus. We're going to do a demonstration of the Magentus eRequest. We are going to demonstrate today what we've done in pathology and radiology using the same AU eRequesting standard that's been developed through Spark. It's important to understand that this is a workflow pattern that supports a service request and fulfillment by the placer and the filler, and Andy will touch on that throughout the presentation. It's key to really importantly understand that it's very different from a HL7 messaging model where a message is delivered and then the job is done. We're doing a back and forth interaction between Magentus and our diagnostic partners. For today's demonstration, we're going to demonstrate Sonic Radiology's workflow, Healius pathology workflow, and ACL pathology workflow. Sonic also do have pathology as well. However, just due to time constraints, that's what we'll demonstration today. I'm going to hand over to Akansha and Andy. Thanks, everyone.
All right, so this is a patient, John, and I'll create a pathology request for him. This request is for Australian Clinical Labs. It's gone for the lab to pick it up. I'll create another request in parallel for another patient. All the clinical information, pregnancy information, that's already pre-populated in here, and that will go along with the request. This request is for Jane for Healius pathologies. Now we can see these requests are here for Australian Clinical Labs and Torevich. And once the lab starts accepting it, making it in progress or completing it, the success will be reflected in here.
Traditionally, HL7 version 2 based messaging has not provided transparency of fulfillment by the filler. In our approach, the clinician can see when a request has been placed, when it is picked up by a filler, when the patient arrives for collection, and when the report has been completed. This transparency ensures greater focus on the clinical collaboration between the clinician and the pathology service, providing greater transparency, trust, and patient safety. You might notice some delay in the statuses being updated in the user interface. This is normal because the demonstration is a little artificial as the status changes happen over time and are not packed together in a real-time sequence as you're seeing in this demonstration.
You can see once the request is completed, you can start seeing here. The one for ACL is completed now. And similarly, when the lab has the request and it is in progress, that would also start getting reflected in here for this lab here. See, this one for Dora, which is now in progress. All right, I will start with creating a radiology request for this particular patient. I'll select a lab, which is a digital lab.
We distinguish digital labs from traditional address book labs. Digital labs have a capability to receive digital orders, while address book labs may not.
Sends an SMS to the patient. You can also print and keep a copy. Otherwise, you can start seeing the results in this section for this patient. So right now it's requested, but then once the lab accepts it, it will start changing statuses, and you can start seeing all the statuses right here from in progress to completed afterwards. You'll start seeing all the statuses here as soon as it's in progress. Now you can see that this request is in progress, which means that the patient has turned up at the radiology center for getting their test done. And then this information is shared with clinician. Now, once the test is completed, you can start seeing the status as completed for the request. Now, as you can see, that the status is completed, and that is reflected everywhere for this particular patient. That's a radiology order all the way through.
Thanks for the great presentation, Akansha and Andy. Just want to close our demonstration with a discussion about where we're headed in the future and some of the future opportunities that we see using the AU e-requesting standard that are developed through Sparked. For certain things such as extended clinical history, looking at AU patient summary and potentially attaching that to the request, which would be really exciting potentially in the future. Round tripping the report, the request, the report going back to the request and round tripping that back onto the FHIR repository. Certainly looking at decision support into the future as well. But right now we are focused on working with Sonic, Healius and ACL on what we call digital request sharing or alternate lab claiming, which is the ability for a consumer's digital data to follow them to whichever diagnostic pathology service that they use. We're estimating that launch will be sometime in June. We're very excited about this because we think this is a step towards supporting the current patient-consumer choice setting that patients' digital data can follow them in the ecosystem. Thank you all for your attention.
So why should others get involved in Sparked? Ross, can I start with you?
think as we were talking about earlier, it's very much an accelerator for interoperability. It's an accelerator for moving into that fire space. It's an accelerator for, if you're not sure where to start, if you're not sure what's involved, if you have young developers who have never seen healthcare standards before, it's a great place to get in and talk to people who've been in the industry a long time. The barriers really break down when we're in those sparked sessions. Outside it might be Sonic versus Healius in some respects, but inside those sessions, we're working together, we're collaborating. We're talking about SNOMED, we're doing all those things where bringing that interoperability really together. And I think that's such a massive thing for the industry to have. And it's all thanks to that sparked events that you guys are hosting.
That's great. And what about you, Mike? Why do you think others should get involved in Sparked?
Look, I think Ross said it perfectly. But I think if there's anyone that's sort of been sitting on the fence, wondering what the value is of being part of it, is the community aspect is certainly the diversity of perspectives and the sort of potential. I work in the partnership space, so there's a lot of people I've met and actually started some form of business partnership relationship because we've been in that community. Where we're now collaborating somehow, shape or form. That could be radiology, pathology, it could be something entirely new, a whole new use case that we hadn't thought of. So I would encourage people to come along because there's a really strong innovation component to that, where you might have come along with a certain perspective, you might have met a few different people and they're working on something that's either adjacent to what you might be working on, and there's opportunities that sort of can come out of it, I suppose not just commercially, but also just to meet people that are sort of all working towards that common goal. Like, we really want to solve interoperability in Australia. Like let's actually make this better for our families, ourselves as consumers, that we're not in a situation in 5-10 years time that you're struggling or you have to carry around a manila folder with all your information between your providers. So that's, to me, we get involved for that aspect if you've not been involved.
No, well said. And I think that in terms of, I guess, the final question here that I've got is, I guess, what is one key insight for adopting these national standards? Maybe I'll start with you, Angus.
Look, you really need to come to those events to break down through the barriers and to the nitty gritty. I think one thing that sparked is there's a lot of hype around health IT. There's a lot of talk. There's a lot of people sitting on panels and eating biscuits and talking about fixing it all. But from my experience, there is only one place I know that is actually fixing it. And that is the Sparked group and these Fire Connectathons. We're not just getting a panel and talking much like this. We're actually getting our computers out. We're connecting. We've got engineers connecting stuff together. It's the real layer. It's the real happening and doing it, right? And so, having those engineers come, they learn the nuances of fire. It's all rosy on the outside, but like everything, the devil's in the detail. And that's really what you're getting out of these events. They're not just a talk fest. They're engineers actually talking about the problems, connecting systems together and learning the nuances of fire. It's a radical shift from where we've been in the past. And I think it needs this sort of onboarding and trainer wheels for us all to be safe to fail and learn the nuances of fire and how it works to get those advantages. Yeah,
absolutely. And I think that connectathon thing is something that's really important to me in terms of getting all the, I guess, technical experts in the room and connecting, and that's why I think there's a huge value in attending those. I guess from Healius's perspective, Ross, what would be one key insight from your perspective?
It's very much similar to what Angus was just mentioning, but in my mind, as he was talking through that, and we've got the developers, we're working through real problems, we're actually doing work in these in the connectathons, but it has a real outcome at the end of the day, right? These are the advantages for the patients, this is advantages for referrers or doctors or people giving care. At the end of the day, it's going to enable better healthcare outcomes, right? And we're doing that through working together. So it's more amazing than that.
And what about you, Akanshka, from Magentus? What's your perspective in terms of one key insight that you'd share?
I like the part that it involves everybody, not just technology companies, not just, it has everybody's perspective, not just one view that is dominating other views. It's everybody combined together. It's everybody's perspective, everybody's views, and that's what is driving the standards that we are coming across to.
Right. Thanks very much. So with that, I just want to say a big thank you for the demo. I think it's really exciting to see where things are heading and the potential for this work and how we can leverage this to get to wider adoption of standards and improve workflow. But I guess for those listening, if you're interested in participating in Sparked, we've included QR codes that would take you directly through to registration, but also please feel free to jump onto the website to explore and have a poke around. We also have a Spark podcast, season 1's there for those who's interested, and we're currently working through on season 2. And we have a lot of information and updates on LinkedIn as well, so give us a follow. And lastly, if you have any questions, you can email us at sparked@csiro.au. So thanks again, everybody. I really appreciate your time.
Thanks, Michael.
Thanks,
Yeah.
Michael.
Thanks, everyone.
Thank you.